اللهم اغفر لي واعف عني وارحمني واحلل عقدة من لساني يفقهوا قولي. السلام عليكم يا جماعة. Welcome to very hopefully informative presentation. Hopefully this is going to be useful for you, and we hope that you enjoy it. I'm going to be with you as long as you need, so you can ask all the questions that you want, so don't worry about it. You don't need to copy anything or take down anything. The entire presentation and the entire slides are going to be emailed to you. It's already in the student club email. It's already there, so they will email it to you. Just make sure that your email is correct. And we're gonna start in just a moment. Okay, so this is a presentation about learning, and basically the idea is for you to become a better learner. This is, it might be a little bit counterintuitive. It might seem to you that you should be good at learning. You've been doing it for most of your life. Unfortunately, this is not the case. There's a lot to learn from the science of education that has been coming out in the past 15 to 10 to 20 years, and this has been increasing in complexity, and actually it has made a difference when you actually understand how the mind works and how your brain works and how you process information, especially when we're talking about adult education. This starts to make a lot of sense to you, and hopefully if you were to take what I'm about to show you to heart, you should be finding that you have changed into a better learner. Your information is kind of consolidating in your brain more. You're remembering stuff more. You're hopefully going to do better on the test. The thing is, what I want you to understand, first of all, this is my declaration. I have no financial ties to anything. So if I inform you about some internet applications, I'm actually telling you about them because I think that they are good. I don't receive any funding from anyone. I don't have any intellectual or financial conflict of interest. So whatever I'm going to tell you with regards to any commercial applications, it's just purely my own opinion. However, I'm not an education specialist, okay? This lecture is not designed to make you a better test taker. There are courses for that. Simply because it depends on what kind of test you were talking about. If you're taking MCQs, it's a different test than if you take long answer questions. There are courses for that. You might benefit from taking something like this, how to become a better test taker. There are such things as bad test takers. Even though they have the knowledge, they don't do well on the exams. This lecture, however, is designed to make you a better learner. It's designed to make you understand the material that you're reading better. It's designed to make you retain information so that when you go into the test, you actually have more of the information inside your head for when you need it. And it's designed to show you how you can actually use up your time to read and learn the text or information or whatever it is that you're learning once and then you need to just fortify it in a much less effort than you did the first time. So you will put in the effort the first time, and then it becomes a lot easier. The problem is that there's a lot of stuff that you need to understand for you to become a better learner. Now, the science of education has been developing over the last 20 years. These are a few of the people who have been spearheading this type of education. Peter Brown, Henry Rogier, and Mark McDaniel, as well as Daniel Kahneman, who's a Nobel Prize-winning psychologist. They all have developed this, and basically what you're going to hear is what's in those two books. طبعا, it's not all of it, but a great deal of the ideas that I'm going to show you today come from those two books. So if you guys want to go back and read them, that's up to you. They're available on Amazon, and I'm sure that you can get an electronic copy on the net. This is what we're going to cover today. So we're going to talk about the myths of education, the things that we think are true, but they're actually not, and they're harming us. The types of teaching and the methods of learning. How do we learn now that we're adults? How is it different from children, for example? How memory works. And then we're going to talk about the most important part of this lecture, which is basically, what do we do about these things? How do we become better? How do we read something and just have it stick in our mind for when we need it for the exam, or when you need it in the ward or in the hospital or in the ER? And what are the tools to make us better learners? So we're going to start with the common myths. Obviously, there's a lot of stuff that is not true about education. Unfortunately, we don't know a lot of it. We think that everything that we've been taught in grade school and middle school and high school, and even at some point in university, is true. And unfortunately, that's not the case. I've concentrated on 5 main myths. So the first myth is basically education is the same in all ages. This is obviously not correct. This is absolutely wrong. Okay? Education changes as you age. Adult learning is completely different from child learning. What worked before might not work for you now. The way that you used to study when you were in high school, or the way that you used to study when you started your medical school, or the way that you used to study when you were in grade school, is completely different when you hit the graduate and postgraduate schools. You guys are now at the last parts of your medical education in the university, and hopefully in a few years you're going to be entering the specialization program. So you have quite a bit of education still active and going on. That's not to say that you will be educating yourself all the way until the day you die, but we're talking about formal education where you're actually sitting in class, taking lectures, and taking exams. So the first thing is, the way that you study is completely different from the way that people study in high school. Myth number 2 is actually intellectual abilities are fixed at birth. You always hear that somebody is just simply good in school, and some people are bad in school. This is not true. This is absolutely wrong, okay? Learning is an acquired skill. If you learn how to learn, you will be good at it. The problem is nobody tells us this stuff. And unfortunately, even for me, I was finishing my boards about 10 years ago. I discovered all of this and everything I'm going to tell you in my last year of residency. Had I discovered this at the beginning of my university years, I'm sure things would have been a lot easier for me. And hopefully it will be easier for you. Myth number 3, you've heard this from your friend. This book is fantastic. It has the answers. It summarizes it summarizes everything for you. Don't worry, everything is collected to you in tables and boxes. Unfortunately, this is not a good idea. Basically, when it comes to information, the more effort you put in to gain the information, the more that information sticks to your mind. If the information comes easy, then it goes easy. So easy come, easy go. If you get the summary from your friend, you didn't actually put in the effort to make that summary, trust me, you might use the summary, or you might use the book, or you might use the notes to pass the exam, but the moment that exam finishes, there is nothing that's left in your mind from the information that you've read. Myth number 4 is basically, don't worry, I'm going to stay up all night cramming for the exam. Everybody has done this. Everybody decides the night before the exam, put on the coffee, turn on the lights, and you stay up all night trying to cram everything in because simply you didn't do good time management from the beginning. Everybody did this. I did this when I was in high school. I did this when I was in university. And sometimes it worked and sometimes it didn't. But in general, this is not a good idea, and it's really short-sighted. It might help you just to pass that exam, but as far as the information is concerned, that information is going to evaporate the moment the exam finishes. The problem that happens is that the brain cannot consolidate a lot of information all at once. It needs time, okay? It needs time to change it, to package it, to push it into the long-term memory, okay? And I'm going to show you how this works. So you actually need to study something and then completely forget it, and then go back and remember it later, and that's the way it sticks. Myth number 5 is basically الكلام اللي دائما يعلموه لنا هو التكرار يعلم الشطار. Go back and read it again. Go back and read it again. This is the biggest lie if ever they told any student in school. التكرار يعلم الشطار. This is one of the biggest lies we've been taught. The problem is, just because you read it over and over again doesn't mean that you understand it. It doesn't mean that you know it. Memory changes, it shifts. This is why people remember different things in different ways, okay? They don't, people are asking me to mix Arabic and English. Actually, you shouldn't be doing that, okay? بس إذا مرة حابين ماشي, we can do that. The idea is, if you go and read something, it doesn't mean that you understand. كلكم بتقروا سورة البقرة. Everybody does it. في ناس ممكن تسمعها. But if I come and I tell you, please explain it to me. فسر لي سورة. A lot of people have no idea. They will recite and they will say the words, and it will be in the correct way and in the correct manner, but they have no idea what the words mean. So just because you read it over and over, it makes you familiar with it, but it doesn't actually make you know it, okay? So having said that, this is basically a map done by the psychologist of our time, Dr. Daniel Kahneman. He's a professor of psychology. He's the author of Think Slow and Think Fast, the book that I showed you. And you can see how many fallacies we have in our brain. Okay, this is why our brains trick us, they fool us, memory changes, things creep up, information get lost. We only listen to what we think we should listen to. So you can see why things change, why you read something and then you remember it differently. Okay, this is part of being human. However, the thing is, we need to overcome this. Now, there are different types of teaching. There are different ways of learning. So if you know what these are, then you can find out what is best for you, because what is best for you not necessarily is the same thing as what is best for her or him. So what's best for X could be not the best thing for Y. So the types of teaching are as follows. Teaching, the classical teaching, is what's called didactic teaching. Didactic teaching is the old type of teaching. It's where you go and you read a book. It's where you go to class and you sit and the professor or the teacher tells you, okay, today we're going to discuss the human cell. Okay? This is where somebody coming from, let's say, a company is going to make a demonstration of a new device. This is what happens in the hospital always. A company brings in a new ultrasound machine, and the representative from that company brings everybody about, and they demonstrate how the machine works. So you simply sit there and you look and you take in information, whether that information comes to you as a form of text, so you're reading it, or you are listening to it through a lecture, just like what we're doing now, okay? Or somebody's actually demonstrating, so you're looking at what they're doing and you're trying to take in all the information. So this is the basic classical teaching. Then there is one step above that, and that is coaching. Coaching is basically, after I've done the demonstration, I'm gonna say to you, okay, so now you try it. And you try to do what I just did, and you make a mistake, and I tell you, no, you shouldn't be doing this, you should be doing that. So this is the feedback. So coaching is when I let you do whatever it is that you're trying to learn, and then I give you feedback. I tell you, you should do X or Y or Z. Or the next time, if you are ever faced with this situation, you should do that situation. Okay? So coaching is basically allowing you to go through the experience, making the mistakes that you're making, and then I give you correcting advice so that you correct it one bit at a time. So every time you redo whatever it is that you're trying to learn, you get better and better and better. One step above coaching is adaptive learning. Adaptive learning is exactly the same as coaching. The only difference is that you are doing it to yourself instead of somebody else giving you feedback. So, for example, you go into the hospital and you meet a patient, and you ask that patient, for example, do you take alcohol? And because he's a Muslim, he's very offended. How dare you ask me this? Of course not. In fact, I don't want to see you anymore. I want a different doctor. Now, if you take a few minutes and think about what happened, so this is an experience. You're going to look at it, okay, so how could I have asked the question in a better way? Maybe the next time I should explain to them that I'm not judging them and it's important to ask because I'm going to change my management according to this, and maybe that will make the difference. So here, you're giving feedback to yourself. You look at the situation, or you look at whatever circumstance that occurred, and you think, what just happened? What did I learn? How could I have done this better next time? And basically, you reflect on what happened, thinking of ways of making it better. So it's kind of like coaching for yourself. The best type of teaching is facilitative or constructive. Constructive teaching is basically, I allow you to go home and do the didactic teaching yourself. You go, you read about something, and then you come and I present you with a situation that makes you use the information you've just learned. So let's say, for example, we're talking about the approach to chest pain. So you go home, you read about chest pain, you read about acute coronary syndrome and shortness of breath, and you see videos, and you basically do the whole thing. And when you come to class, now I didn't teach you anything about approach to chest pain. I'm just going to give you a case. So I'm going to tell you a 36-year-old patient comes to you, and he's young and he smokes. However, he doesn't have hypertension and doesn't have diabetes, and he's complaining of shortness of breath and chest pain that is retrosternal, lasting for 2 hours. Now what do you want to do? So basically, I'm testing what you did at home. I'm facilitating your use of the information, and this is what problem-based learning is. I give you a problem, and you're going to go through it, you're going to make mistakes, and I'm going to give you feedback and coach you through it so that your understanding of the information that you've studied at home is better. I can provide simulation. So, for example, a lot of physicians, they don't know how to do surgical airway because it's a very rare procedure, or how to do thoracotomy, where you open up the chest to do a cardiac massage in the traumatic cardiac arrest. We do that in the ER, but such procedures are very rare. The problem is we really have to train on them. So simulation is one of the ways where I actually have to provide you with the circumstances in which you can actually apply that knowledge. Same thing with seminars and discussion. The idea is you read a book and then you come in and we discuss it. So I didn't actually give you the information. I'm actually using the information that you have studied to further your understanding, and this actually shows whether or not you understand what it is that you studied, because if you didn't understand, you cannot have a discussion. A flipped classroom is exactly the same, where you actually go and you read and you find out all you can about a subject, and then in the classroom you are given a test, and basically you discuss the test after you take it, and you decide on which course of action to take depending on what you have read. So all of these are different ways of teaching. Now please bear in mind that even though simulation is a great way to teach, it still needs the didactic type of teaching. If you don't do that at home, you cannot do simulation. Because if, for example, you want to do a simulation for an operation, let's say, you're a general surgeon and you're trying to practice how to do, let's say, cholecystectomy. Okay, so there's a simulator where you can actually go and you can actually try to do the operation in a simulation lab. Now the problem is that if you don't have the knowledge, simulation is not going to help you. Simulation only gives you the chance to apply the knowledge. So for example, if there is bleeding that happens in the scenario, if you don't know what to do when bleeding occurs, then you're not going to be able to do the simulation. So you have to have the knowledge by didactic means, and then apply the knowledge through facilitative learning. So learning methods, obviously there is passive learning, and this is what we've been doing in previous grades where you were in school. You read and you read it again, and you read it again, and you highlight, and you underline, and then you come the day before the exam and you cram everything, and you try to make lists, and you try to make tables, and all of that, unfortunately, is very time consuming. It gives you the feeling that you've studied when in fact you did not understand the material. All you did was waste your time making yourself familiar with the material, but you didn't actually know it. You don't understand it. Okay? And this is what we're trying to stop. We don't want you to be passive learners. What we want you to do is be active learners. Active learners produce algorithms. So if I'm trying to understand how to approach shortness of breath, for example, okay, I can make an algorithm, a flow chart. So when the patient presents, what's the first thing I should do? Well, is he stable or unstable? Okay, so that's the first decision. Now, if he's unstable, what's the problem of the instability? Is it his shortness of breath? Is it his heart rate? Is it his blood pressure? Or is it his level of consciousness? So from that, you go down to 5 questions. If he's stable, then I'm going to go to the history and so on. And you make this algorithm. And if you can understand this and go through it, then you understand the material. Always, always, pictures say way more than words. So if you can simplify something through a graph or a diagram, definitely it's way better. This is where the information posters have come up, okay? It basically tells you all you need to know through pictures. Practice test questions, we're going to go through these in a lot more detail in the coming slides. The idea is for you to know what to ask and then to have something where it's going to help you in the exam. And the most important thing is when you take in information, you have to actually take it in, process it, and then put it back out again. So explain what you've just read. Explain or teach what you have just learned. If you can do that, then you have just proven that you understood what it is that you actually read. So this is the cone of learning. This is basically Dale Edgar's cone of learning. And it simply states that if you were doing passive learning, so reading or hearing a lecture, you're going to remember about 10% of what you read and 20% of what you hear. If you're looking at a picture, you probably are going to remember 30%. If you're watching a demonstration or you're actually looking at an exhibit, you might remember 50%. If you're actually having a discussion, that's where you start with the active learning. Then you're probably going to remember almost 70% of what you discussed. Or if you're giving a talk like I'm doing right now, I'm probably going to remember 70% of what I'm talking about right now. And the next time I present this, I'm going to remember 80% and so on. And if you're actually doing a procedure or doing a simulation, obviously you're going to remember a lot more. So the more engaged you are and the more active learning that you have, the better it is. As you can see at the top right corner, it says, I see and I forget, I hear and I remember, I do and I understand. That's Confucius. Confucius, for those of you who don't know, is a Chinese philosopher that lived 2,300 years BC. So even then, they knew about learning. Okay, so what's the steps in adult learning? There are 3 steps in adult learning. There's something called encoding, and there's consolidation, and there's retrieval. Okay? Now, encoding, this is the idea of how you take in information. Are you reading it? Are you listening to it? Are you participating in it? So basically, it's the way that you perceive information. Okay? Now, this obviously depends on the type of learner that you are. There are 9 types of learners. I'm sure that everybody knows that they prefer a certain way of receiving information. And these are the types of learners. There are people that cannot learn unless they read, so they take in visual. There are people that they actually need to have to do it. They need to demonstrate it for themselves. There are people that can listen. I'm one of the people that actually I learn and I understand more by listening than by looking. So, for example, if I'm driving, I can put on a lecture and I will probably remember a lot of it more than if I just sat and read it from a book. There are people that learn when they're relaxed, and there are, on the opposite side, there are people who learn when they're under stress. A lot of the ER physicians are like this. It's when we're running in a trauma or in a cardiac arrest that we learn the most. There are people who tell you, I cannot remember anything unless I write it down. And there are people who basically learn if somebody says so. So if I like Professor X and I think Professor X is fantastic, so if Professor X teaches it, I'm gonna know it because simply I like that guy. The best way is obviously to teach. So a lot of people they tell you, I'm not really sure that I learned the material until I actually give a lecture. And of course, there are the people who copy. They need to copy the information bit by bit so that they take it in. So it's up to you to find out which type of learner you are and try to increase the way that you take in information through that route. Consolidation is basically the mind trying to package the information that you've just encoded. You've taken in the information through your eyes, through your ears, through doing something through your hands, and basically your brain is trying to package that information so that it actually goes into the long-term memory. Okay? This unfortunately requires time, and it requires your understanding of how memory works. Okay? Now, when you build your knowledge, so you take in information, you have to give your brain some time to package the information. What you're doing is building a wall of information. This is what you want your information to look like. You put one layer and then you build on it and then you build on it. So you understand the anatomy and then you understand physiology and then you understand pharmacology and then you understand pathophysiology. But you cannot understand pathophysiology if you don't understand physiology to begin with. So you have to learn the basics, the foundations, and then you build on that. The problem is you need time to do that. When you take in information, you have to give your brain some time so that it actually packages the information. If you were to, for example, cram for the exam the night before, it might save you. The problem is the information after your exam is going to look like this because you did not allow time for the cement to actually become hard. And you just piled information on top of information on top of information, and now everything looks like a mess. And a lot of you, I'm sure, you have been faced with questions by consultants. الconsultant تسأل سؤال وتجاوبه في حاجة تانية ويجي الجواب something completely different. والconsultant يجي يقول لك إيش؟ No, you misunderstood. الجواب هذا للسؤال هداك مو لهذا. Okay, صار معايا لبس. This is what happened. You tried to take in too much information. You read the entire chapter all in one sitting, and the information now is basically collapsed on itself and mixed together, and you don't know what is right and what is wrong. Now, out of the three, the encoding and the consolidation, retrieval is where the main problem is. This is where most of the students have a problem. This is where most of the residents have a problem. This is where most of the humans have a problem. Okay? They tell you, I read it. I read it every single word, and I was awake, and I was paying attention, and I was writing it down as a summary, but I can't remember anything. Okay? It's the act of retrieving the information. This is the ability to actually revisit the information that you've taken in, that your brain has already consolidated. And this, unfortunately, uses memory, which is not perfect, and it changes with age, and it changes with time, and it changes with a lot of things, as you've seen before. When I put that diagram of the brain and the cognitive fallacies, basically this is the part that is difficult. This is the part that is exhausting, and it takes a lot of time to actually master, and this is where we fail. So if you want to become better learners, we have to learn how to do this in a better way. So first of all, we need to understand how memory works. So if you understand how memory works, then you will be able to change your study habits to become better learners. So as you know, there are two types of memory. There's the short-term memory, which is like the RAM in your computer, okay? The problem with the short-term memory is that it's very, very small. It can only take in 8 objects. Actually, it's more close to 4 or 5. However, it's extremely detailed, and this is where the computation happens. When you're thinking about something, when you're deciding, when you're trying to make a choice, that's where it happens. It's the short-term memory. You have to bring something into the short-term memory before you can actually do any operations on it. The majority of your information, who you are, your identity, your previous history, your life, people you know, people you don't know, exist in the long-term memory. This is the hard drive. When you are born, this is blank, and you fill it up as you go. Obviously, when you reach to my age, this is somewhat full, okay? Now, there are debates whether or not you can actually keep filling it, or if there's actually a limit to memory. This is not something that is agreed upon. But to me, for example, every time I learn something new, I'm sure that I've forgotten something old that I don't need, okay? To make a better example and to make you understand this better, this is how your memory looks like, okay? It's a forest. You have a lot of trees, and in the middle, you have a clearing where there's no trees. Now, this clearing is the short-term memory. So anything you need to work on, anything you want to concentrate on, anything you want to take a decision on, you have to bring from the forest into this clearing so that you can actually do the cognitive operations on it. Now, most of the information is in the long-term memory. It's in the forest. It's in between the trees. So here you have all these facts, everything that you've ever learned, everything that you've ever seen is present in that forest. Everything that you've done since you were born. The problem is, even though you have it there, the thing is you can't get to it. Not everything. And that's why sometimes you try hard to remember something and you just cannot get it. And then probably maybe a year later, suddenly when you're doing something else, it just pops into your head. What you've just done is you're moving into the forest and you suddenly stumbled on a piece of information that you didn't know was there. Now, the way that you get information is basically through paths that connect the clearing to the information. So the information when it's in the clearing, when it's in the short-term memory, it doesn't last for long. There's a lot of things that remove that type of information. First of all, and the most common thing is, it's removed by other information. It's removed by distractions, definitely being removed by alcohol or drugs, okay, or even emotional distress. So as an example, let's say, if your mom tells you, please go tell the driver to go to the pharmacy and get my hypertension medication, okay? So that request made its way into the clearing in your brain. So you go to tell the driver what your mom told you. Halfway through there, you didn't get to the front door yet, your phone rings, and it's your friend, and your friend is crying. What happened? Oh, they fired me today. I lost my job. Oh my God, I'm so sorry. What are you gonna do? What happened? Now, that piece of information pushed out your mother's request. You've completely forgotten about telling the driver. You've completely forgotten what your mom told you. And basically what you're doing is you're dealing with this new situation. So this other information that came in pushed the old information out. Plus, there's probably an emotional factor to it. So there's also some distress. So when do you remember? When your mom comes back to you about 2 hours later, where's my medication? Oh my God, I completely forgot. I'm sorry. I was going down to tell him, but I got this phone and it completely slipped my mind. And this is exactly what happens. So not a lot of stuff can stay in the clearing, and then it's removed by a lot of things. Now, the way that you get information from the forest into the clearing is through neural pathways. And these look like this. They look like roads in the forest. The more you walk down that road, the bigger the road. If it's information that you commonly recall, the road is going to be big. The smaller the road, the more obscure the information. So for example, if I asked any one of you, please read Surah Al-Fatiha to me, everybody's going to recite it. Why? Because the road to that piece of information in your brain is very big and it's very wide. Why? Because you are reading that every single day, every single day. But if I came to you and I said, please tell me what are the names of the carpal bones in the wrist, then probably this is more of an obscure information than Surah Al-Fatiha. You know it. You know this information and you know that information. The problem is Surah Al-Fatiha, you're reading every single day. You're recalling every single day. But you're not recalling the names of the carpal bones every single day. You might need it probably once per year or twice per year at this level. Okay? So the more obscure the information, the smaller the path. So you can see how things get lost. You see, if it's something common, then your road becomes paved. It becomes established. You keep going back and forth over that road until it becomes wide enough and it is established. Now, if, for example, you memorized Surah Yasin, okay, and you started to train on it, so now you have it committed to memory. If you stop practicing, what's going to happen? The forest is going to start to grow over your road. The less you use the information, the forest is going to keep growing and growing and growing over your road until you can no longer tell where the road at. the information is still there. The problem is you can't get to it. This is lost information. This is stuff that you have forgotten. Okay? So your mind kind of looks like this. It contains everything. Everything is here. The problem is getting to it. So the more you access the information, the more established the neural pathways are. And that's why you have to practice. You have to retrieve information for information to be retained. Now, having said all that, now we come to the practical part of the presentation. How do we fix what we have just said to be wrong? How can we become better learners? Well, first of all, let me put this very clear. There is no magic bullet. This is not magic. This is not a shortcut. There is no free lunch. You actually have to do the work, okay? If you work hard, you will become a better learner. If you don't work hard, you're going to stay as you are, or maybe even less, okay? So there is no free lunch. You're going to have to work to become a better learner. However, you're going to have to work smart. So it's not just studying hard, it's studying smart. You can't steal time, you can only borrow it, which means that if you decide, for example, to stay up and study for the exam, those hours that you've stayed up, you need to repay to your body. You need to repay them to your brain. ما بيسد ساعة النوم غير ساعة نوم. If you lose 1 hour of sleep every single day, after 2 weeks, you've just lost 14 or 15 hours of sleep. You're going to be as tired as hell. Okay? So you can only borrow time when you need it. If you are having a problem or a crisis, fine. But then you have to pay it back. Okay? So you can't steal time. You can only borrow it. And sleep and exercise are going to be your best friend. The best way to get your brain into shape is to get your body into shape. Your body has to be well rested and it has to exercise and eat well. Okay? So, how do we fix our learning? Well, we're very good at encoding. We can take in information. We can read, we can listen, we can watch, we can demonstrate, okay? But we need to improve our consolidation and we need to improve our retrieval. These are the problem, and mainly the retrieval. So these are improved in 5 different ways. Number 1, retrieval practice. Number 2, spacing. Number 3, interleaving, something called interleaving. I'm going to explain what this is. Okay, number 4, generation, and number 5, elaboration. And to help those, we need learning tools. So there's something called the Pomodoro Method or the tomato method. Okay, Pomodoro is the Italian word for tomato. You need to learn how to chunk information, and obviously you are using mnemonics right now, but we need to add a few things like sayings and reflection and calibration, and we're going to talk about each one. So, retrieval. As we said before, the more you walk the path, the better the path becomes. Okay? So walking the path from the clearing to the stored information improves the position of the information and makes the information more available. Okay? It stops the forest from growing over the path and removing it from your view. So this is not done by simply just going back and reading the text and going back and reading the text, because we've said that before. If you read the text, it doesn't mean that you understand it. What you need to do is test yourself. How many times have you found that you've read the text, but when the consultant gave you a question or your friend asks you a question, suddenly you're drawing blank. The reason why you're drawing blank is because you didn't understand anything you read. You just read the words and you understood them, but you didn't, you read the words and you took them in, but you didn't actually understand them. Okay, so the better way to find out where your gaps are or whether or not you understand what you've read is basically testing yourself. And you can do that by simply putting yourself in a situation where you have to answer the question. This is what simulation is. Okay, I provide you with a scenario and I tell you, imagine if you had to do X or Y, which one will it be? And then you will argue, well, based on the case and so on and so forth, I'm going to choose X. Okay, so you have been forced into a discussion. So if you don't understand the concept, you are not going to be able to do that. You can do the testing by doing quizzing, by doing flashcards, by doing group study, which is, by the way, one of the best things you can do, because you're going to question your friend and force him to retrieve information that he supposedly has mastered, and they will question you and force you to retrieve the information that you should have mastered. And the best type of questions are open-ended questions, not MCQs. The best kind of question is, explain to me how does this work? Or what is the pathophysiology behind this phenomenon? This type of open-ended question is going to force you to think of a framework. It's going to force you to come up with information that you've known about this pathophysiology, and it's going to force you to put it in a way that I have to understand it in. It's completely different from the MCQ testing, where I provide you with choice A, choice B, choice C, and then you just have to choose from these choices. Okay? MCQ testing is literally the worst testing you can do. The problem is, this is the only way that we do it, so that we have equal testing for everyone, because we know that some people's language is bad. We know that some people don't know how to form sentences properly. So this is the only way that we can be assured that everybody takes the same exam. Okay, and this is why MCQ is the reigning way of doing exams. Plus, it's much easier to score a test by a machine or a computer than having to read the entire article that you wrote and then decide based on an opinion. So what is the Pomodoro Method? Obviously, the Pomodoro Method, the person who came up with this name because he was using this timer. Okay, this is a kitchen timer, obviously. I'm sure some of you might even have it in your homes, and it looks like a tomato. That's why it's called the Pomodoro Method. The Pomodoro Method helps you to overcome your bad habits when you're studying, okay? Now, when you come to study, let's say you have 2 chapters. You have cardiology and you have endocrinology. Now, everybody likes cardiology. Not everybody hates endocrinology. When you sit to study, you have to apply the Pomodoro Method if you want to overcome your bad habits. This is the way of breaking up the task into small bits called chunks, okay? And doing it in a way so that you don't get bored, and at the same time, you're actually doing progress. So the first thing you should do, the first step in the 5-step method, is assign your task. Don't just say, I'm going to open the book and study. No, I'm going to finish page 32 all the way to 37. Okay, so assign what you're going to do. And always try to start with the most difficult. So if you don't like endocrinology and you like cardiology, then start with endocrinology, because by the end, you're going to be reading something that you like, something that's easier on you. So always start with the more difficult task. So assign your task. That's your first step. Your second step, set the timer for 25 minutes or maybe 35 minutes. Please don't go above 35 minutes. Don't put it at 40. Don't put it at 50 or 1 hour. The idea for having 25 to 35 minutes is to have a small time limit. And this is what we call the Pomodoro, okay? So set yourself a Pomodoro, okay, 25 minutes, and in that time, you switch off everything. You close your door, you go into a room, you don't do anything except work on the task that you assign to yourself. You switch off your phone or you turn it silent. You just do the work for 25 minutes. Now, because it's 25 minutes and it's not too long, you don't get bored. And because it's 25 minutes, it's not too short, you actually get some work done. Now, when the timer goes off, obviously you can have the timer on your iPhone. It doesn't have to actually be a kitchen timer. So when the time limit finishes, then give yourself a break. So go and watch TV for 15 minutes or 5 minutes or 10 minutes. Usually it's 20 minutes of your Pomodoro. So if you're assigned 25 minutes, then your break should be 5 minutes, okay? Check your Twitter, check your Facebook or Instagram, okay? So once you assign your work, put your timer, remove all distractions, go into a room and just do that piece of work for the next 25 to 35 minutes. And once you're done, give yourself a small break and then repeat the same thing 4 or 5 times per day. If you do that, I can guarantee you, you're going to put in so much work and you're going to finish so much work that you will not even feel it. The trick is, don't make the Pomodoro too long. Chunking. So that's the Pomodoro method. That's the first of the learning tools that we've learned. Chunking. When you come to study a chapter, don't look at it as a full chapter. You can just scan through it at the beginning, look at the pictures, look at the tables, look at the boxes, okay? Look at any diagrams, and then go back and split it into sections. It's like looking and doing a puzzle, okay? So if I'm going to talk about, let's say, acute coronary syndrome, okay? I'm studying cardiology, so I want to study acute coronary syndrome. So I'm going to break it into chunks. So this is a chunk, this is a chunk, this is a chunk, and of course there are some chunks which are big, there are some chunks which are small, and basically I'm going to split the topic down into, for example, presentation, diagnosis, treatment, complications, and then I can even split these chunks up down to further things. So complications, I can have early complications and late complications, okay? If I'm talking about management, for example, reperfusion management versus supportive management. So I can break these chunks up, and all I have to do is just get those chunks and commit them to memory. So what's supportive treatment? Oxygen, put the patient on a monitor, get an ECG, start an IV, take the lab, start him on a small bolus of fluid. So for example, this is the supportive chunk for ACS. When I'm talking about, let's say, the early complications, so arrhythmia, hypotension, cardiogenic shock, mitral valve rupture, heart failure, and death, for example. So that's a chunk. Then after I have all these chunks, what I need to do is link them together. Now I can do that by doing a mind map, or through the outline of the chapter. Okay, so this is where I put the algorithm. Okay, so I can have the management at the bottom of the page, I can have the presentation at the beginning of the page, and I connect this to this, to this, to this, and therefore I cover the entire topic. So chunking makes things easier. Okay, so this is where, for example, when I was studying for the board, the two consultants, well, they're now consultants, but then we were just residents. When we sat and we decided we're going to read, for example, orthopedics, instead of each one taking a chapter, so instead of me taking the pelvis chapter and my colleague taking the elbow chapter and somebody else takes the shoulder, no, instead of that, what we did, everybody does a chunk. So I'm going to do diagnoses. So I just go into each chapter and I don't do anything except read diagnoses. How to diagnose. So X-ray here, MRI here, CT here. Somebody else goes in and he does management. Somebody else goes in and he does complications. So he takes the complications of hand injuries and complications of shoulder injuries and complications of elbow injuries and complications of hip injuries. So he's just doing the complications. Somebody else is just doing the management. Somebody else is just doing the diagnosis, and so on. So you're taking that chunk out of the chapter, and this makes things easier. Now, in the beginning, we didn't have the internet as diverse as nowadays. Nowadays, you can carry your entire library of books in your phone, okay? What we had at my time was this. We had books, and of course, we highlighted everything inside. This is just useless. It's a waste of time. You think that you're doing, that you're studying, okay? This is actually one of the books that I had. I mean, how the hell do you study from this when it comes times to do the exam? It's absolutely, you just have to read the whole chapter again because you've underlined everything. Okay, so you, by producing something like this, this is just simply useless. It's wrong. You're wasting your time. Basically, just don't do it. Now, as computers came along and then we had iPads, we decided to do something similar, but still electronic. Okay, so this is what we did. So we just opened the PDF, the book that is in electronic form, and simply we just cut and paste and cut and paste. So for example, here, this is a classification of spinal cord injuries, okay, secondary spinal cord injury and so on, primary and secondary. And basically what I did was I used to just cut and paste and cut and paste, and I have a summary. The problem was that the summary that I got was almost as long as the chapter, because simply I'm taking big chunks out of the chapter and putting them in point form, which basically I'm editing the book. Okay, so this is not very helpful. Now, what you should do is as follows. First of all, you have to avoid your illusion of competence. If you do this, if you do a summary like this, you might think that you have mastered the material, when in fact you haven't. Okay? The illusion of competence gives you the idea that you understand what it is you've just learned. So reading and rereading gives you this feeling that you know what it is that you've read, when in fact you don't. Underlying, same thing. Reading the answer without having to work through the problem, okay, gives you the same thing. So when you have the question and you don't bother to think about the question and come up with your own answer and you just read the question and you read the answer, this is just simply a waste of time, because nothing is sticking. You're just reading the words, you're not actually retaining information. Seeing the information doesn't mean that you know it. You could be looking at something. I cannot tell you how many times I brought the same picture in the academic activity for the residents in the emergency program, and then when I got the same picture in the exam, nobody knew what it was. In fact, some people didn't even remember it. Okay, so seeing doesn't mean that you know it. Highlighting and underlining is just a waste of time. Okay, spending this time doesn't mean that you know the information, and if you recognize the information, it doesn't mean that you understand it. And if you're familiar with it, doesn't mean that you understand it. Okay, so this is the problem. So now, what should you do? If I'm not going to underline and I'm not going to highlight, what should you do? This is the way you should look at it. So bear with me, I'm going to read to you from a text. So let's say, for the sake of argument, that this is what you're studying for your exam. So chest wall injury. So I'm going to read, it says, principle, background, and importance. The susceptibility of rib fracture increases with age. These injuries can be exquisitely painful, but their importance lies not in the fracture itself, which generally is self-limiting and will heal, but rather associated complications, particularly pneumothorax, hemothorax, pulmonary contusions, and post-traumatic pneumonia. Rib fractures in children are discussed in this chapter. So, reading this, what I have to do is I have to extract the bits of information from this text. So if I do that, this paragraph simply becomes rib fractures increases with age, and rib fractures are associated with pneumothorax, hemothorax, pulmonary contusion, and post-traumatic pneumonia. That is what that paragraph says. Going on, anatomy and physiology, okay? An intact chest wall protected by its rib cage is necessary for normal ventilation. Outward expansion of the thorax by respiratory muscles with descent of diaphragm creates negative interthoracic pressure. This allows passive air entry into the lungs during inspiration. Chest trauma, particularly blunt trauma, can severely disrupt the physiology of respiration. Fortunately, most individuals have substantial respiratory reserve and can tolerate significant chest wall injury with adequate support. So all of this, كل الدش ده كلمتين. Air is taken in by expansion of the chest and flattening of the diaphragm, creating negative intrathoracic pressure. يعني السطرين هذه is embedded in 7 or 8 lines of text. Moving on, continuing. Flail chest results when 3 or more adjacent ribs are fractured at 2 points, allowing a free segment of the chest wall to move in paradoxical motion. Figure 38.1. With the flail segment moving inward with inspiration and outward with expiration, it can also occur with costochondrial separation or vertical sternal fracture in combination with rib fractures. Underlying pulmonary contusion is considered to be the major cause of respiratory insufficiency with flail chest, and it is therefore one of the most serious chest wall injuries, figure 38.2. In addition, flail chest can be associated with a variety of other injuries, including hemopneumothorax, liver or spleen laceration, and mediastinal injury. So all of that simply contains this. Flail chest is 3 or more ribs broken at 2 different points. Flail chest can occur with rib fracture due to costochondrial separation and vertical sternal fracture. Underlying contusion is the main problem, and associated injuries are hemopneumothorax, spleen injury, liver injury, and mediastinal laceration. So half a page comes down to this. Now, what we used to do, and if you are really good, what you got is this information and you put this in a Word document, and now you have a summary. The problem is that all of this is still just as big as the text. And just reading it doesn't mean that you understand it. So what are you going to do? So what you should do is as follows. This is the first box. Now what you need to do is create a question from your mind. The answer to that question should be this information. So instead of saying rib fractures are associated with pneumothorax, hemothorax, pulmonary contusion, and post-traumatic pneumonia, you should replace this with list the associated injuries expected with a rib fracture. So the answer to that question is exactly what you got out of the text. The first piece of information, what happens to the risk of rib fracture as the patient's age increases? Obviously, it increases. And after the question, you put the page number. So this is at page 382. List the associated injuries. So I put 4 in parentheses. That means there are 4 injuries. And that is the page number. Okay? Same thing. Second paragraph, errors taken by expansion. So I need a question where this is the answer. So the question is, explain the mechanism by which respiration occurs. Same page number. That's where I find information. The big one, the third one, okay? So here, if I consolidate this into questions, I get 3 questions. What is the definition of a flail chest? So flail chest is 3 or more adjacent ribs broken at 2 different points. What is the main cause of respiratory compromise in flail chest? Well, the main cause is pulmonary contusion. And finally, list the injuries expected to be found with a flail chest. 7 things. So costochondrial separation, vertical sternum fracture, hemothorax, pneumothorax, spleen injury, liver injury, and mediastinal laceration. So now you can see that all of that part of the page has been consolidated into 6 questions. That is it. Now, when you do summaries like this, okay, you've extracted information from the text into point form, and then you came up with a question for which the answer is the points that you've extracted from the text. And then, if you finish the chapter, what you're going to end up with is a list of questions. And the answers to those questions is simply everything in the chapter. Do you know what you've just created? What you have just created is a mock exam. So basically, if you do this and you end up, for example, with 70 questions or 80 questions or 200 questions, all you have to do when it comes time for the exam is try to answer these questions. And these questions will remain for you. It will help you to practice your retrieval of the information. And of course, even if you don't get the information correct from the first time, you can go and look it up. That's why we keep the page number. So here, for example, I'm going to show you. This is from my residency. I was doing the arrhythmia chapter. So you can see here, number 1, what are the differential diagnoses of ST segment elevation? There are 18 of them. Do you really think that if I put 18 lines into a list, I'm going to memorize it? Of course I'm going to forget stuff. Okay? So now when I come to study this chapter, I go in and I say to myself, okay, so what is the differential diagnosis of ST segment elevation? 18. Okay, so there's acute MI, there's post-arrest, there's pacemaker, there's left bundle branch block, there's heart block, there's pericarditis, there is post-thrombolytics, there's post-trauma, there's myocarditis, and you can see I'm not going to get all 18. If I get 12, let's say, then I go back to page 1004 and I check, oh yes, of course, hypothermia, I forgot that. And this is the way you learn. Now you can go through a list of questions way, way faster than reading the entire chapter again. If you do this for a chapter, you don't have to ever read the chapter again, because the answers to those questions is basically everything in the chapter. So the first time out of the 18, you're probably going to get 10. Maybe the second time you're going to get 14. Then probably you're going to get 16, or maybe all of them. And that's how you should be studying. Okay? List 10 causes of ST segment depression. I might get 5 at the beginning, and then 7, and then probably 9. But that will be more than enough to improve your mark in the exam. This is the way that you guys should be doing your summaries. Don't underline, don't highlight, just extract the information and try to make up a question where that information is the answer. And you keep the list of questions. This is your mock exam. This is the exam that you can take anytime you want. This is the exam that's going to train your memory to get the information out. And it's a lot easier to go through 400 questions in 4 hours than to go through 34 pages of text, fishing out information every single time. So this is way, way easier. Okay. في أحد بيسأل shouldn't you put the answers, or don't you have? If you put the answers, you're just going to make another book. The idea is we don't want you to copy the book. Okay. If I make a summary, that's all I'm doing. I'm just copying the book. I'm taking cut and paste, and this is what we used to do. I don't want to do that. I used to end up with, for example, a chapter that was 35 pages. My summary is about 30 pages. That's all. I took 5 pages out. That is not good enough. Okay? The idea is keep the question. That's it. That's all you have to do. And then memorize the answer. And every time you read the question and you don't get all the answers, you go back and you check your answers. The idea is to go through the retrieval exercise. This way, it will give you confidence before the exam. If, for example, the exam is tomorrow, you can go through the list of questions in the morning and then give yourself a couple of hours break, and then go through them again in the afternoon and another couple of hours break, and then you can go through them a third time. You actually went through the chapter 3 times before the exam. And your confidence level is going to be way better. السؤال يكون بالعام ولا حسب صياغتي. You can do it yourself. Just decide on a question where the answer to that question is exactly what you got out of the text. Now, this is what concerns retrieval. Spacing. Spacing is basically having to do the retrieval at more than one time. You cannot basically stuff information into your brain just one time and that's it. You need to revisit the information, and you need to do that at different intervals. So allow your brain to rest. So how do you do that? You can set an alarm, you can do a schedule, you can write a calendar, you know, and say, for example, I'm going to study cardiology today, and I'm going to revise it again in 10 days. Okay? You use the Pomodoro Method to allow you to do that. You do, for example, you can say, I'm going to study the cardiology chapter today, and on Thursday, when I meet up with the guys for our group study, I'm going to have them examine me in the same material. One thing you can apply is you can use the osmosis application or the QStream application. These are two fantastic applications. Again, I don't endorse any commercial applications. I don't have any financial ties to them, but I think they're really good because they provide you with mini videos. They provide you with flashcards, with questions, and the nice thing is you can actually put what your favorites are, what your things that you don't like are, and you can actually, the application actually gives you an alarm, and it says, you know, you've been practicing orthopedics and trauma for quite some time. It's been a while since you've done psychiatry or toxicology or whatever, the stuff that you don't like. It actually bleeps and tells you, look, it's been a while, you really need to study electrolyte imbalance, for example. So this is the idea. There's a question here, Abdul Majid. So you only make questions at the end of each session without writing the information in the extracted manner. You don't write the extracted information. You extract the information into your mind, and immediately you form the question and you write the question down. Okay? So you see, for example, let's say you know the Ranson criteria for pancreatitis. So immediately you make up a question. What is the Ranson criteria at presentation? Another question, what is the Ranson criteria at 48 hours? And you write the page number. And if you want, you can, if it's a list, then you write, for example, it's 10 things or 5 things or whatever it is. The idea is you put the question there to challenge your mind to retrieve the information, and you put the page numbers, so once you've finished your challenge, you can actually go and check the information and remind yourself what it was that you forgot. Moving on, okay, so you need to rest your brain, so you need to study cardiology, for example, and then forget it for 10 days. Study something else, okay? This gives time for the cement to harden so that you can build on the information. If you try to stuff in too much information, what's going to happen is your wall will collapse and the information will become intermingled and you're going to have a mess. Okay? Spacing happens as follows. This is what happens in your brain. So this is retention and this is time. Let's say, for the sake of argument, that this is day 0. This is where I sat and I studied my material. So when I studied my material, my knowledge and my retention is way up there at the black dot. That's where I've learned the things. I've finished the chapter today. I've learned everything. If you ask me about it, I know the material. I can answer you. Now, what's going to happen is that over time, that information is going to go down. Please, if you don't mind, can we keep the questions till the end? I'm going to be around and I can answer all your questions, but I can't stop every time somebody asks a question. So let's keep it to the end, okay? And I promise you I will answer all of them, okay? So if you study your information at day 1, at day 0, okay, this information is going to start to go down. So the next day you don't have the exact amount, the day after you forgot a little bit, and so on and so on, and the amount of information keeps going down and down and down through time. Now this line is basically the 50% mark. So you can see here that the distance here and here is about the same. Okay, so the time that you need for the information to reach 50% is at the red line. Let's say the red line is 7 days later. So if I read the chapter, by the time a week has passed, I've forgotten half of it. Okay, so my information goes down over 7 days until it reaches the 50% line. Now, if at that time I go back and study it again, so I pick up my list of questions and I go through it and I cover the chapter again, I'm gonna push back my retention to the same place that I had it at 1 week earlier. Okay, so I went all the way back up, and now my forgetting curve becomes shallower. So it takes me a lot longer to lose the same amount of information. So here at the green line, that's where I lost 50%. Look at how much time has passed, okay? So the more you revisit the information, the more you retrieve the information, the less forgetful you're going to become. And if at that time you revisit it again, so I study it now, I study it after a week, and then I study it maybe after 6 weeks, by that time, my forgetfulness curve is going to be really shallow. So I'm going to retain, by the end, 70 to 80% of the information simply by reading it twice after I've finished my summary. And please notice that the major part of the work is the beginning. It's making the summary. It's extracting the information and making the summary. Once the list of questions is there with the page numbers, that's it. All I have to do is just go through it, and it takes probably a small fraction of the time to go through it. You can go through it with a friend. You can go through it by using an app. You can go through it by taking a test, whatever you like. But the idea is your retention keeps going up and up and up, and you can see that the second time you, just by reading it one time after you made the summary, the same information is lost probably 8 or 9 times less, or less slower, okay? So your retention increases, your satisfaction increases, and your work actually decreases, because you don't actually have to go and read through the entire chapter again, or read through the highlighted sections again, simply because you have to now pick it out of the text again. Okay? So this is what spacing is. So having a mid-year and a final exam is okay, but if you had 9 quizzes, that's way better, because you are revisiting the information every month or every 5 weeks. Okay? So the people who have 9 quizzes are way, way better, and they are going to retain information way better than the people who just have a midterm and a final exam, because they are not going to be testing that information except on 2 different occasions during the year, while the others are doing that in almost 9 different occasions. Now, the internet platforms that we talked about, so this is Osmosis. You can see here I have it open on the emergency medicine. There's videos for you to see. Each video is about 10 minutes. Some of them are longer, okay? You have all the different topics, so internal medicine, neuro, psychiatry, pediatrics. Obviously, there's flashcards. You can go by organ system. There's basic science if you need to learn anatomy all over again. It's a really, really good site. I recommend that you all go and register in this site. There is a free part, okay? So you can register for free, and they will open some of the videos up for you. But if you want the full thing with the flashcards and the questions and everything, I think you need to subscribe. The other one is QStream. It's an application. It will give you MCQs. It depends on your settings. So you can actually say, you know, I need more training in cardiology, or I need more training in trauma, and it will actually give you more questions of the things that you need to train on, and it will give you all the stats that you need to do. So you can actually improve depending on what you find your knowledge gaps in. Now, first thing is retrieval, second thing is spacing, then we have interleaving. Interleaving just simply means blending, okay? A lot of people like to do things in sections. So let me study all the cardiology chapters. So I'm going to study heart failure, I'm going to study dysrhythmia, I'm going to study acute coronary syndrome, I'm going to study pericarditis, I'm going to study cardiomyopathy and valvular heart disease, all after the other. And then when I'm done with cardiology, I'm going to go and study respiratory, for example. Okay, so I'm going to study asthma, COPD, pneumonia, and so on. So if subject X studies in such a fashion, cardiology, then pulmonology, then GI, then ortho, and you have somebody who studies cardiology one day, pulmonology the other day, the next day pediatrics, the next day neurology, the next day trauma, the guy who studied with interleaving patterns retain information better, because that's the way that life works, and that's the way that exams present. They don't give you, you know, MCQs from 1 to 10, those are cardiology MCQs, then you get from 10 to 15, those are ortho MCQs. No, it's mixed. You go from obs and gynae to ENT to pediatrics, back to ENT, back to toxicology, and so on. So the more you do interleaving, the better, okay? Basically, it allows you to differentiate and appreciate the differences, okay? So for example, if you studied adults bronchial asthma, and the second day you're studying pediatrics, and you go over the pediatric asthma, it is only then that you can see the similarities and the differences. When you read the management, you're going to say, oh, you know what? In adults, we manage it in such a way. But in pediatrics, we manage it in a different way because of 1, 2, 3. So now, if retrieval is basically walking the path from the clearing in the forest all the way to where the information is inside the forest and back, that's what retrieval is. Interleaving is basically jumping from one part in the forest, so you're at the information for bronchial asthma for adults, and you jump to bronchial asthma in children. So you kind of make a connection between the paths. So instead of just going from the information to the clearing, and then from the clearing to the other piece of information, you just go direct from one to the other, okay? Again, guys, please leave your questions to the end. So it's better to study cardiology, pulmonology, then cardiology, then pulmonology. Or for example, let me study the complication of the TB medication and the seizure medication and the depression medication. So I can see the differences in the different medication and complications each one brings. So the only way that you can appreciate these types of differences is through interleaving or blending. Fourth thing is generation. Generation is the term given to basically, before you read the answer, challenge your brain. Even if it's something you don't know, just go ahead and give it a try, okay? So for example, if I told you, how would you approach somebody with a pneumothorax? Now, you haven't read this yet, so just do your best. Sometimes you're going to get the right answer. Sometimes you're going to get half and half. Sometimes you might get the wrong answer. The idea that you actually forced your brain to actually think about something that it hasn't learned yet, it had made or generated an answer or generated a mind model. Okay, so what happens is when you finish your answer, basically, just one second. When you finished your answer, basically your mind is open and more receptive to the information that you're going to read. And when you actually read the answer, you can compare the one that you came up with without studying with the one that's in the text. And if it's the same, you're going to be really happy. And if it's not the same, then you're going to see, well, how come I came with something different? Oh, I see what I did wrong. It was this, or I didn't do that here. If I had known this, I would probably get the same answer. So here, what happens is you actually can find out why your answer is correct or incorrect and where are you making the mistake. Okay, so always when you're trying to learn something new, challenge yourself. Try to attack the problem before you look at the solution. Okay, to force yourself and to force your brain to come up and generate an answer and then compare that answer to the real answer. Okay, elaboration. So number 5, so we have reflection, spacing, interleaving, generation, and elaboration. Elaboration, this is the process by which you actually make the information yours. So for example, all the stuff that I'm telling you about, these are not my ideas. These are Peter Brown's ideas and Daniel Kahneman's ideas. They wrote it in their book. So I took this information and I made it my own. I made it into a presentation. I said it in a different way, in a different model. Okay? So taking the information, this is exactly what you're doing when you're doing the summary. You're extracting information and then you're coming up and generating a question and elaborating on that question in your own words to make it into a summary. So this is rearranging the same concept and saying the same thing in your own words, to teach it, to present it, to discuss it, to know it. And this is basically what tells you that you actually understood the information that you read. So for example, an example on elaboration, for example, I was trying to explain acute cardiogenic pulmonary edema to my residents. Okay, so it's the state where you have fluid in the lungs, and it's usually due to heart failure. Okay, so for example, I came up with this idea. Okay, so this is a bathtub. So here, the lungs are the bathtub, and the lungs are full of fluid. So the bathtub is full of fluid. Now, what we need to do is empty the fluid. Okay, so the edema is the fluid in the bathtub. The tub is being filled by a faucet, and that's the right side. That's the RV. That's the part of the heart that's pushing blood into the lungs. So that's what's filling the lungs. And the left side is what's emptying the lungs. And this is represented by a motor. Okay, so I came up with this idea to make them understand. So the question is now, how can we empty the tub? Well, the first thing you do if you sit in a tub full of water is turn off the faucet. So the first thing is close the faucet. So you need to lower the amount of blood going from the RV into the lungs. And you can do that by lowering the venous return. How do you do that? You give a vasodilator, nitroglycerin, for example. It dilates the vena cava, and therefore the pressure in the vena cava goes down, and therefore the amount of blood that reaches the heart is less, and so the amount of blood reaching the lungs is less, so you turn off the faucet. Second thing is, the fluid that's already there, we need to get rid of it. So how do you do that? You make the drain bigger. So What's the drain? The drain is the blood pressure. If I make the arteries bigger, then the water is going to go down. How do I do more than that? Well, I get a better motor, or I supercharge the motor. So I start the patient on inotropes, so dopamine, epinephrine, norepinephrine, and this is going to pump the water more out. So this is an example of elaboration. I took the information from the text, I put it in my brain, and I came up with this to make you understand. Okay? This is elaboration. Okay, so finally, we're reaching the end now. So the tools that are going to help you for better learning, that are going to help you to retrieve, help you to space, help you to come up with different ways of doing things, okay, are as follows. Okay, mnemonics. You all use mnemonics. Everybody, this is a fantastic way to remember. So I teach my 5th years when I used to teach in Ibn Sina. I used to tell them, anytime you need to document pain, you have to document old car, onset, location, duration, character, alleviating factor, aggravating factor, radiation, old car, so that you don't forget. If I ask my residents now to name the carpal bones, they will tell you. Some ladies try positions that they can't handle. So scaphoid, lunate, triquetrum pisiform, trapezium, trapezoid, capitate, hamate. Okay? If somebody has a pneumonia, what's the score for mortality? It's curb 65. So I look for confusion, uremia, respiratory rate above 22, blood pressure below 90, hypertension, and an age of 65 or above. If any of those are there, this patient is more at risk of death. So mnemonics, you're all familiar with. Please keep using them. They're good as long as they make you remember. Anything that makes you remember, do it, because it's going to cause you to retrieve the information and strengthen the path of the information, and it's going to give you retention and a better learning. You can do it into songs. When I was in the board, believe it or not, for example, we wanted to come up with a way to figure out the pediatric heart diseases and when did they present. So we made it into a little song. So in the first day, it's PDA. After 1 week, it's hypoplastique. At 14 days, coarctation outweighs. In 1 month, you'll see a big VSD. So if you can sing it, then you can remember it. And believe it or not, this is the way we went into the board. Okay, it might be childish, it might be silly, but we remembered the information better than our colleagues. You can have it into sayings. Okay, تعملوا أمثلة. Okay, so for example, one of my colleagues just said Vibrio, Cibrio. So if you have a Vibrio infection, then you give ciprofloxacin. So Vibrio, Cibrio. It's silly, but it makes you remember. In sepsis, you save the kidney, you save the patient. So the first priority in the sepsis is to save the kidneys. We used to say, if they don't cruise, they don't bruise. So when I get a child and he has a bruise or he has a fracture, and the parent tells me, oh, well, he was walking and he fell down. Well, the patient is 3 months old. They don't walk. So how did he fall down? Then I'm thinking that this parent is doing something abusive to the child. So we used to say, if they don't cruise, they don't bruise. It's a way of making us remember, okay? Or every ECG begets another. So if you get an ECG, you have to get a second one. You can never get one ECG. So all of these are sayings. It's just a way of making you remember stuff, okay? The neuro exam. How do we remember the neuro exam in the ER? Hear them talk, see them walk, and look at their eyes. If all of those are negative, their neurological exam is intact. That's all we need to do. Okay, so it's ways of making us remember. Reflection, as we said, is self-feedback. It's important. You should take a few minutes to actually think about the different situations that you go through the day. حتى في الحياة العامة يعني if you had a clash with a friend, or if you had a fight with someone, you should just stop and think. What happened? Why did it happen? What did you learn from it? So how can you avoid something like this in the future? Or how can you learn from it? Okay? So it's basically what you usually do when you go to bed. When people go to bed, they start thinking about their day. What happened to them that day? And how could it be better? And what was the problem? And all of these things. If you apply this to your studies, believe me, you're going to discover certain things that you wouldn't have discovered otherwise. Okay? And finally, calibration. Okay? Calibration is when you receive feedback to see and make sure that where you are is basically where you're supposed to be. Okay? It's an objective way of trying to keep in the place where you're supposed to be. You're not being fooled or think that you know more than you know. You're basically at the same level as your colleagues, because when a consultant gives you feedback, they tell you how you did relative to your colleagues, relative to your friends. Okay? So you're performing way better than them, you're performing less than them, you're performing at the same level. So it's an idea of basically knowing where do you fit. Because believe me, there are people where you come and you tell them, look, I think that you have a problem in history taking. And what does the resident do? No, 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 no. Everybody says I'm okay. Everybody says I'm fantastic. Everybody says, you're the only one who said that. This is lack of insight. Okay? They don't want to accept that they're not as good as they think they are. So this is something that's going to keep you grounded, keep you in reality. Okay? Keep recalibrating your feedback so that you know where you stand relative to other people. So finally, this is what you need to do, guys. Okay? You need to be aware of the myths. Okay? You need to know what type of learner you are and what type of teaching you need to do. Okay? The best way to consolidate information is basically to do retrieval testing. Now, whether you do it through a group study or flashcards or application or whatever, it's up to you, but you have to do it. This is the way to it. Okay? When you summarize information, try to use the Pomodoro Method. It's short, effective intervals that is not too long so you don't get bored, and it's not too short so you actually do some progress. Okay? The other thing is, when you summarize information, make it count. Put it into chunks and summarize the questions. Don't summarize the answers. The idea is for you at the end to have a list of questions, which is a mock exam. It's like you are testing yourself before the test. So this is a dry run, okay? You're examining yourself before you go into the exam, because the worst thing is for you to sit, study and study and study, and you're doing a lot of work, and then you go into the exam and you're faced with a question and you draw blank. And the reason why you do that is because you did not understand material. Okay? Let the material solidify. Try to get a lot of sleep. Okay? A lot of exercise. If you try to cram stuff, your wall is going to crumble. Avoid illusions of competency. Avoid rereading stuff or underlying stuff. It might work for the short term. Okay, if you cram, it might save you for the upcoming exam tomorrow. But the problem is, it's not going to make you retain the information. And if it's only passing the exam that you care about, then maybe you can get away with it. but it doesn't always work. Okay? Space your practice and interleave your topics. Okay? Always try to attempt the question before you read the answer. Own the information. When you extract the information, write it in your own words. Explain it to your friends. Teach it to your colleagues and know it. Okay? This is going to make you a better learner if you use mnemonics, if you use songs, if you use reflection, whatever it is that makes you remember stuff and retain information, do that. You only become more rich in knowledge when you start to understand the differences between the concepts. How can I tell an anterior cerebral artery stroke from a middle cerebral artery stroke? So for me to do that, I have to know the presentation in this and the presentation in this, what is common and what's different. And this can only be done if I interleave my topics. Okay? Finally, exercise and good sleep are your best friends. Whether you think you can or whether you think you can't, you're always right. This is Henry Ford. If you believe that you are going to be good at your exams, you will be. And if you believe that you're going to be bad at your exams, you will be bad. It's what you believe. What you believe and what you think your abilities are extremely important to your success. So practice like you work, because you will work like you practice. So if you practice good, you're going to work good. And if you work good, then you practice good. And it's a vicious cycle. Okay? So information that comes easy, where you haven't put in any work, is going to go easy. It might stay in your mind for a little while. Okay? So if you take the summary of your friend to study for an exam, it might save you for the exam, but the information is going to go away. It's all about the struggle. The more you put an effort, the more it sticks. Okay, so remember, please, it's not easy, because if it was, everybody would have been a physician. It's a hard life, and you are going to learn from the day you are born all the way to the day you die. Now, I hope that I've presented you with something that is going to help you. Thank you so much for allowing me this opportunity. And I'm here to answer your questions, so we can go one by one, hopefully. So I'm going to start with the questions that were there before that I didn't answer, and I'm going to go one by one. So Abdul Majid, I think we already answered your question. Dr. Lama, I usually summarize important info from the university presentation in 5 pages in my notebook, and then read from a book and add more info. I'll try to summarize each lesson in 2 to 4 pages. Then I close my notebook and ask myself a couple of questions and note them down. And after a while, I read my summary and ask myself more questions. Is this effective? Well, the idea is, if you join a study group, have somebody else who has studied this material ask you stuff. And if they ask you a question, for example, if you and I were doing a group study, and I ask you a question and you can't answer it, then there's a problem in your knowledge gap. Okay? The thing is, always study from the text. It's good that you take information from the presenter or the lectures, but in the end, you have to study from the text. The good thing in the lecture is there's better explanation. Okay? The professor or the consultant that is lecturing to you might say things in a different way to make you understand better. Okay? So for example, if you're reading the pulmonary edema topic, and I give you the example of a bathtub, this is something that you can add into your notes. But in the end, if you're going to have to read through your notes to prepare for the exam, that's going to take too long. And you're going to feel rushed, and you're going to feel that you have so many things you need to do. It's way better to summarize the entire topic into questions, even from your notes. So you can fuse your notes and the text into one simple question list. Okay, so this is for Dr. Alam. Dr. Anwar, what do you think about Sketchy Medics? I have no idea what that is. I'm sure it's a good app. So if somebody has used it, and if you think it's good, then by all means go ahead and use it. But I'm sorry, I don't know what it is. I haven't tried it. Dr. Abdulaziz, I have heard that if you test your mind during studying, it's a harmful way. What do you think? This is not true. Okay? Anytime you test your mind, you can recall information. Okay? So there's no such thing as I'm in studying mode and I'm in testing mode. Okay? When we used to study for the board, we used to, for example, go through a chapter, then so that we don't get bored, we stop, we'll do 1 hour of MCQs, then we'll read the answers, then we'll explain it to each other, or if we chose different answers, everybody tells the other guy why they think the answer is A instead of B, or B instead of C, and then we go back and we look at the answer, and then we move on. Okay, so interleaving is something extremely important. Whether you go from studying to testing, back to studying, back to play, then exercise, then sleep a little, then back to studying. So you can interleave as much as you want. Okay, so that is not harmful. دكتورة غيداء, thank you very much. كويس انك استفدتي. دكتور عهود, do you see the flashcards is useful? How can we use it? Yes, of course it's useful, because the questions that you saw in the summary, these are exactly what flashcards are. It's a question and the answer is at the back. Okay, so instead of going, but the idea of writing the page number is that if the doctor says, or the consultant says, your exam is going to come from Harrison, for example, Harrison's Internal Medicine Review. Okay, for you to make flashcards is going to be a lot of work. So you're going to write the question, and then you're going to write the answer, and it's a lot of work. So just by writing the question and the page number, you can apply it to any book you want. And this doesn't have to be in medicine only. It can be in any subject you want. Okay, but we're talking about medicine here. So you can do this in the anatomy book. You can do this in the pathophysiology book. You can do this in hematology. You can do this in anywhere. Okay, so this is the idea. Usually flashcards, they come pre-prepared, and by the time they get to you, they're usually out of date. Okay, and if the exam is coming from a certain book, I think you should stick to the book as far as the exam is concerned. As far as general knowledge is concerned, you can study from anywhere. You can study from any book, you can study from any lecture, any symposium. The idea is, this is the thing that I gave you is, if you have a book, which is usually the case in 90 to 95% of the time, you're given a book that, this is the official text for this course. Okay, and that means that the questions are going to come from the book. So if you can cover the information in the book, then by definition, you have just covered the information on the test. That's the idea. So, for example, in emergency medicine, our official text is the Comprehensive Emergency Medicine Practice of Peter Rosen. Okay, that's our textbook. That's the reference book. So the board, the Saudi board, questions for the Saudi board comes from that book. So everybody has to study that book, even though there's a lot of stuff in that book that are not true. Okay, but so that we have closure and we tell the students where to study from, that's where they get it. Okay, Dr. Maha, so the summary in the book and the questions I make in another book? Well, you can do whatever you like. Usually what I do is I open Word and just read through the chapter, and every time I see something that I think I should know, I make up a question and I write it in Word, and then, for example, I have my cardiology summary or my orthopedic summary or whatever it is. So it's up to you. Dr. Farah, you're welcome. She's thanking me for a good session. Thank you very much. دكتورة رغد، دكتور عندي سؤال. أنا تخيلت عن فكرة إني أجهز نوت منفصل لأني أخذ وقت مرة طويل، بس بدال كده صرت أحدد على الكتاب نفسه. هل التغييرات هذا ما في شيء غلط. Whatever is good for you. Okay. The idea is the idea from making these questions is that you can use it later on as a template for the exam. That's number one. Number two, you can use it to practice your retrieval. Number three, whatever the information answers for those questions, that's exactly what's in the chapter. So I don't need the chapter anymore. That's the idea. Okay, but you can do whatever you want. You want to write the questions in the margin of the book on the same page, that's fine. Whatever works for you. Okay. Dr. Hadil, isn't the interlacing method distracting? It's not interlacing, it's interleaving, and it's not distracting. It's actually, it has been proven by research. And they got people and they made them study subjects all in a row versus people that were studying subjects randomly. The people who studied the subjects randomly had better retrieval and had better retention of the information. Okay, so, and when you get, for example, if you're studying, let's say, cardiology, then you're studying pulmonology, then you're studying pediatrics, then by the time you get to the end of orthopedics, you would have forgotten the cardiology. But if you mix it up, at any one time, you have a little bit of everything. Okay, that's the idea. Dr. Razan, you're welcome. Dr. Hadil, Dr. Maha, if time is too short, 4 weeks for medicine, for these strategies, what you can do. Well, again, I told you, if you need to cram, you can do that. The best thing probably is to do a group study. Okay, you cannot believe how effective group study is. Again, you need to do the work. I'm not sure how you're gonna do if you tell me that I have no time to do the summaries and what have you. At least you know now what the problem is. Okay, you can practice retrieval. Okay, you can practice doing question instead of just rereading. Is this going to be enough? I don't know. It depends on how much you've done before and how much time you have. Okay. دكتور، هل تعتقد انه قراءة نفس الموضوع من اكثر من كتاب بيسبب تشتت؟ لا، ما يسبب تشتت. The problem is انه انا ممكن اقرا من اكثر من كتاب، ولو قريته نفس الموضوع from different specialities, you're going to have so many different things. Okay, and this is why it's rich. So if, for example, let's say you're talking about acute MI, if I read this from the point of view of emergency medicine versus if I read it from the point of view of cardiology versus from the point of view of ICU and from the point of view of internal medicine, I'm going to find that it's even though it's the same disease, I'm going to find completely different stuff. Okay, the idea is you're looking at the disease from a certain point of view, from a certain angle. So, for example, all the emergency medicine physician wants is for the patient not to die in the ER, while somebody, for example, in the ICU, They're just interested for them to stabilize so that they go to the ward. While the cardiologists just want them to be stable so that they don't see them very often in the clinic and they don't have to admit them every now and then. So reading the same topic from different books doesn't cause you to become fractured, okay? The problem is you don't have that time. You cannot cover the entire syllabus and the stuff they give you and read it from this book and that book and that book and that book and that book. If you have the time, fantastic, go for it, but probably you don't. Dr. Ahoud, you're welcome. Dr. Rima, you're welcome. Dr. Zayed, you're welcome. Hopefully إنه دكتورة رغدة بتقول she didn't lose her attention. Anyway, that's all the questions. If anybody has any more questions, I'm happy to answer them. You have the summary for all the slides. You can just go back and look at them slowly and at your pace and try what I've been telling you. We have people in our residency program, after they started to do this, they picked up an easy 12 to 15% over their score in the exams. Okay, it was that effective. Okay, but provided you do it properly and you put in the effort, and basically you can try this and see how it works. دكتورة سارة كيف تقدر تتواصلي معايا؟ my phone number is with the دكتورة رغد ودكتورة وعد, plus my email is with them. You can find me on Twitter, you can find me anywhere really. فعندكم في الجامعة الدكتور ياسر النفاعي is a very dear colleague of mine. You can contact him. He's a fantastic educator as well. So hopefully this is going to help you in your studies and it's going to help you to become better learners. And by definition, it will hopefully get up your scores. Okay. What you need to do is attend a course that will show you how to become better test takers. And if you know how to beat the exam as well as having the information, trust me, you are going to score in the high 90s. Okay, it's simply inevitable. Okay, so I hope that this has been somewhat interesting, and I'm sure you've learned some new things. Thank you very much for your hospitality. I'm very happy that your student club is doing these events during this time, and I'm extremely proud to be a part of this schedule. Thank you very much for having me. آخر القول الحمد لله رب العالمين. يعطيكم العافية وشاكر لكم.